President White. So I do want to begin my report this evening by addressing the question posed by some in the community of whether the board has been paying any attention at all to science, data, and health experts. I've avoided going to the data because I know that two people can look at the same data and draw two entirely different conclusions. It would serve little purpose to debate the meaning of the statistics because for many, this topic elicits an instinctual response, either fight or flight. I empathize with both feelings, and I don't want to disparage either. Nevertheless, I'm resolved to state the facts so that the public knows that I am looking at the data and not approaching this from some ideological point of view. And lastly, because looking at the data leads me to an unfortunate conclusion that I must call our attention to. This morning in California, according to the California Department of Public Health COVID-19 Public Dashboard, there have been, on the next screen you can advance that, there have been 7,755 deaths. There have been 0 deaths in children ages 17 and under, even though they are 9% of the total cases. There have been over 6.5 million people tested, and unfortunately there are, as of this morning, 400,769 cases. That means that the total death rate is 1.93%. Now, of those deaths, 76% were people aged 65 and older. We also know that many of those souls have pre-existing complicating conditions. So what about the age group 18 to 49, where most of our staff would fall? There have been 241,406 cases in that age group and just 508 deaths. That's 0.21%. You are more than 4 times as likely to be killed in an auto accident in that age group. For ages 50 to 64, the death rate among cases is 1.69%. I admit that that is high. With these age groups, we also know that many multiples of people have had the virus but didn't even know it, thus implying that the actual death rate is most likely significantly lower. That said, I do not discount the loss of life, even while I also believe that when we implement all of the health and safety guidelines, our schools may actually be the safest place in town. The data conclusively shows that on-campus school is safe for students. However, this pandemic has evolved into a heated debate about whether on-campus school is safe for adults. When I drive around town, I see long lines of cars going through the drive-thrus at In-N-Out, Chick-fil-A, etc. And I think about the employees of those establishments who work together in close proximity for hours and hours each day. I don't think any of us would argue that fast food is an essential service. Yet we expect those people to continue serving us when cravings call. Education is essential. Teachers and staff are essential workers. They are valued and appreciated. And in our hearts, we all know what is best for our students. Our state legislature, governor, the American Pediatric Association, and even the now famous Dr. Fauci all agree that students really need to be in school. In California, AB 77 states that in-person instruction should be offered to the greatest extent possible, end quote. How about data from our own teachers and staff? Now, this data is from a survey about 3 weeks ago, and man, a lot has changed in 3 weeks, but nevertheless, since I've received many comments about this and the public wants to know what did that survey actually say, I've summarized some of the most interesting findings from that survey. 788 of our approximately 950 certificated employees took that survey. That's about 83%. Here's what they said at that time. Between 52% and 90% say that online learning works for grades 4 through 8. So that was the range depending on the grade level. The higher grades being the higher percentage of teachers saying that online learning works. For grades TK through 3, it ranged from only 6% believing it's effective to 30% for grade 3. 78.7% said that student participation in online learning was either unsatisfactory or needs improvement. And in our hearts, we know. 83% are either very concerned or concerned that students have fallen behind academically. That's because in our hearts, we know. 84.2% are either very concerned or concerned that students are struggling with social and emotional issues as a result of these extended school closures. And in our hearts, we all know. 59% say that schools should resume on campus while adhering to state and federal guidelines, and at the time, only 8% preferred online only. 72% said that they would have no complications returning to work. The 28% who reported some complications included those who have childcare needs, those serving as a primary caregiver for a family member, those with chronic health conditions, and those aged 65 and older. Only 63.7% felt that they are very supported or supported by their school and or district. That number is too low. I also reviewed every one of the 54 unique emails or unique individuals that sent me comments. Some of you even sent me more than one. And I categorized your responses. 32 were teachers, 10 were teachers who are also parents of kids in the district, and 5 were parents. The rest were other citizens or retired teachers. 33 of these people, or 61%, supported the board's direction of giving parents and teachers a choice for on-campus or online only. Only 20% of these emails that I received called for online only. The rest of the emails did not express an opinion or were against the blended hybrid model. I also documented the suggestions, concerns, and questions posed in these emails. The resulting list covers 64 topics, some with multiple subparts, so in total there are about 75 or 80 distinct issues that were raised. I'm providing a copy of this list to the superintendent and my fellow trustees, as I don't have time to address each and every point right now. So that's what the data says. And based on the data, I still believe that more damage is being done by remaining closed and offering online learning only. I also believe that everyone's health and the educational preferences of parents are sacrosanct. That is why I still believe that choice is the best policy. Unfortunately, our governor has taken away choice. So, I've reviewed the California Department of Public Health guidance, which Kevin referred to tonight, on school reopening, which was published this last Friday. It's a good document. I encourage the public to read it. And I do note, as did Trustee Woolridge, that it does allow for a district to petition the local county health department for a waiver to reopen. All in all, after reviewing the data and guidelines and hearing input from so many of our stakeholders, here are the 7 key points that I am in favor of. Number 1, delay the start of school. Give our community more time to get the virus under control, and also make sure we are prepared for safety and for doing online learning with excellence. Remember when we used to start school around Labor Day? That seemed to work okay. Number 2, prior to the start of school, let's make sure all of our teachers get trained. Let's offer an open house for parents and staff to get comfortable with what on-campus life will look like, much like we did with the video. I thank the staff and Jennifer for putting that together. I look forward to future iterations of the videos. Number 3, accountability is paramount. We must define what online learning really means and what does good look like. Work must be graded, tests must be taken. Any physical packets should be returned, and we can quarantine them for however many hours public health guidelines dictate, and then we can review them. I know that parents were very dismayed to learn that packets were not received and reviewed back in the spring. District curriculum should be used online and standardized so that we don't rely on a whole host of apps and other technologies. Not that there was anything wrong by our teachers getting creative in the spring, but we need to be more organized this time. I think teachers should be on campus while they're doing their online teaching, unless they are a parent without daycare options, in which case I think they should be allowed to teach from home. We need our PLCs to continue. I agree with using TOSAs, and we need to keep attendance. Number 4, when we do resume on campus, either by an approved variance or removal of Kern from the monitoring list based on 14 days of declining case counts, whether we're resuming because with our plan for choice or going back to regular 100% on campus, I would support a phased reopening where we bring back our TK through 2nd or 3rd grades first for a period of 2 to 3 weeks, perhaps even in a half-day model if busing can work, or maybe even a 4-day model with a cleaning day on Friday. Then we could bring back 4th through 6th grade and then junior high. Number 5, if we follow through with the staff recommendation for bringing all of our special needs students back on campus, then I think that those teachers need medical grade PPE. That would be N95 masks and face shields where necessary, since their risk for our SPED teachers and their exposure is vastly different to general ed. Number 6, I'd also like to see the district purchase portable air purifiers or filters for each classroom and make sure that we have good ventilation in every room. Lastly, number 7, let's make sure we distribute the detailed reopening plans and closure criteria or triggers to all staff and parents as soon as possible after this meeting. Make sure that our employees have clear explanations of their sick leave and other medical benefits. Make sure that our plans address all of the questions that have been submitted. And also, let's make sure to comply with the state guidelines. Based on my thorough reading of all the public comment and input, I believe we have already addressed or will be able to address every point that has been submitted. And lastly, for the benefit of everyone watching, please know that staff has been researching all of the issues and concerns, and that at the last 2 board meetings, their comprehensive draft plan was presented, but it was only presented to the trustees. And unfortunately, that led many of you to question whether any serious planning was even being done. This cabinet and this administration and the people in this room,
Are they checking that I can go to school?
The breakdown has been in communication, and we must.
What are you going to say my name?
Not yet.
Sharing the draft plans could have caused more confusion, especially when the situation changes daily, hourly,
Just listen.
by the minute. Thank you for supporting your schools and Panama Buena Vista and the entire team
Is that the
here.
principal?
We will get through this.
No.